everyone. Welcome. So excited for you to join us. I'm Sherry Underwood. I am with Healy World, as Diane and Tammy are. And we're so excited to talk to you today about not only frequency medicine, about the Healy, but also so excited to have Tammy here as a chiropractor and how she's using it with her holistic health, whole background and everything. So I'm going to let her talk about that. Thank you so much, Diane and Tammy, for joining in. This is awesome. I just want to say quickly, give you a background on what frequency medicine is. It is not new. Some people think it is new age, and it's actually ancient. And everything is frequency. Everything is energy. If you think about every single cell in your body, down to the very atom, your cells have a positive and negative charge. So they are energy, and energy gives off frequency. So if you think of an opera singer who can sing and match her tone to shatter a crystal glass, that's frequency. If you think of, when you're thinking of someone and the next thing you know, they call you on the phone, that's a frequency. So there's frequency and vibration and energy, and we should all be using this. And we have some really cool information to talk to you about it, but I'm going to hand it over to Diane and let her talk more about the tool that we have to really dig in deep with frequency.
Awesome. Thanks, Sherry. So this is the tool that we use. It's called a Healy. It has a quantum sensor device inside, and it reads your bioenergy field, and then reports back what your body is deficient in. And then you can run programs when on those frequencies with frequency to give you an uptake in what you're missing. So you can either wear it on your body and it gives the energy to your field, or you can use electrodes and little pads and give microcurrent to your body. And those programs run for like 40 to 50 minutes. So that's basically what it is. There's a whole lot more, but that's just the gist of it. If you want more information, we can give it to you. So what we're here to talk to you about today is actually Tammy. Tammy, I've known her since junior high, and we've been friends since then. And she is a chiropractor, and she reached out to me when I was posting some information about the Healy and was interested. And so I gave her some information, and she decided to jump on in. I think she's been interested in this kind of medicine for a long time, but I'm going to let her tell her story, and she can give her a little bit of a background about her. So go ahead, Tammy.
Okay, so I'm a chiropractor. I have been a chiropractor for 22 years. I went to Life Chiropractic College West in the East Bay in California. And one of my teachers was Bruce Lipton, who spoke about epigenetics and frequencies, and how frequencies actually in our environment really affect who we are and who we become, and how some people that can grow up in some neighborhoods that might not be the best neighborhoods still can flourish, and that has to do with their genes and their frequencies. And so it was really fascinating to me, and I have always known that there's this emotional component to chiropractic, and our frequencies and things that come into our lives that affect our frequencies. There's, stress affects us, and toxins, and everything. It's not just a physical aspect to chiropractic. And so recently I had a patient that came to me with debilitating knee pain. and she had gone through MRIs and CT scans and x-rays and all the best doctors, and absolutely they couldn't find anything wrong with her. And so we were acquaintances through kids and just knowing each other, and she just like had this epiphany that she needed to talk to me. And so I started adjusting her and taking care of her, and she would get better, and her knee felt better. And then over time, it started localizing into her low back. And she'd get adjusted and the pain would go away. And then it would come back at times and it would be debilitating. She couldn't move, she couldn't walk. It was just horrible. So we were trying to brainstorm and figure out what exactly was going on. Like, is she doing something? Is she working out? Is she does yoga? Is it something she's doing in yoga? And we couldn't really pinpoint what it was, because she'd be fine. And then all of a sudden she would like not be able to walk. So in the meantime, she had been communicating with me about how she's been going through her daughter having an eating disorder and being bounced around from hospital to hospital throughout the country. And so we started to realize that every time she saw her daughter, either her daughter would come home or she would go to visit her, was when she was having these debilitating pains. So we realized, it got to the point where it was like, okay, you're going to see your daughter this weekend, you know, just be aware that this is probably going to happen. And at that point, it really was an eye-opening experience for me, because it really was a pinpoint emotional component to why her back was going out. So, you know, typically we think of chiropractic and, you know, we have an injury. We bend over and something all of a sudden pulls and it goes out. And that's great. But this whole emotional aspect is huge. And it's really hard to tap into how to change that. And so when I started hearing about the Healy, when Diane posted the information, I was like, this is something that I could use to help my patients get through these emotional aspects of, you know, it's not just a physical problem. This is something that's happening in their systems and their body, and a way to address it. So that's why I jumped in right away, because I knew that this would have a profound effect in changing that frequency to help somebody that's going through something that's an emotional component. I just received my Healy about 2 weeks ago. So I'm still getting it implemented into my practice. And one thing I've realized is that it's the way I run my business, it's pretty busy. And so getting like to use it on people, some of the programs are a little bit longer. So what I've been doing is using the vibrational aspect for it. And I get them set up and I'll just scan them with the resonance, and then I will turn on, while I'm adjusting them, I'll turn on the vibration. And so they're getting that vibration while I'm adjusting them. And honestly, with an adjustment, it is a frequency change in a person's body anyway. So with the Healy, they're just getting, you know, that much more energy into their field. But it's a beautiful thing when I give an adjustment to a patient and they come in and they're very stoic and, you know, just very serious, and then I adjust them and immediately there's like a smile on their face and they completely change. So that's what I'm most looking forward to with using the Healy. It's so new that for me, so I haven't had any profound results yet, and so we'll have to do a follow-up with, you know, the patients that I've been using and it on, and how it's helping them. So are there any questions?
Yes, I have a ton.
Okay, great.
So,
Excellent.
Yeah, so you were already familiar with frequency,
Yeah.
which I think many chiropractors are, especially with the Healy, like Diane said, you can use microcurrents. So like I was having shoulder issues
Yeah.
and actually using the microcurrent, but it's so nice to not have to use that
Right.
if it's inconvenient. So you are you focusing on using it with the microcurrent on clients or on patients or
You
not?
know, I haven't yet, because of time. A lot of the programs for the Healy are like an hour, 45 minutes to an hour. And I just haven't had the opportunity yet to implement it in that way, but I wanted to get started using it. And so what I have been doing is when I do the vibration, I'll set it for like, usually I'm with a patient for 15 minutes. So I'll set it for 12 minutes. So the whole time I'm with that patient, they're getting that vibration.
Isn't that amazing? I love that. I love
Yeah.
that. Send them. Um, and then, so I think that it's not for my thought for chiropractors was it's not taking away, like I know I
Right.
still need a chiropractor. I love
Right.
them.
Exactly.
But it enhances, like when I come home from him, then I'm able to continue that, sending the healing vibration to my shoulder or, hooking up to the current. So yes, I still need him, but I don't want to put words in your mouth, but aren't you happy to have another tool
Yeah,
to be able to?
yeah, it's really profound in that way because I can adjust a patient and within 5 or 6 hours, if they're really acute and they have something serious going on, they will go back out of alignment. And that is reality. I mean, I can, adjust and adjust and adjust, and people can still get pulled out of alignment because our body has memory. We have frequencies that, we are dealing with, and we don't know that we are. It's just, our systems. And so having something at home that can help you adapt and to the change, the positive change of an adjustment is they just go hand in hand. So yeah, no, it is a tool that can be used in conjunction and really helpful for people going through, physical ailments. I mean, it's reality. We do hurt ourselves. And so, yes, it will help with that, but it goes so much deeper. And I think really can help on a spiritual level almost.
Right.
So.
Right. And like your patient who knows that her daughter or
Yeah.
the I don't want to blame her daughter, the meetings
No, right.
with her daughter caused that she could have a tool for, run that program, that relax program while she's with
Right.
her daughter. And,
Right.
and yeah,
The
so
grounding aspect,
yeah,
just as moms, we do carry the burden of our kids, and our body does stuff that it changes our frequencies. I mean, we're carrying the stress and the anxiety and the depression, which changes us. So if we have something that we can change that back and bring balance, it will really be helpful. So
yeah, that's how I feel. Cause I love chiropractics. I totally understand being in alignment, but there is that emotional, mental, and physical pain that Healy can deal with. So I just love that.
definitely. Yeah. Okay, what else?
Diane, did you have a question? Because I have another
No,
one.
I just wanted to touch on the fact that it goes, I think the emotional is a huge part of a lot of like a lot of chronic issues, chronic pain, and getting to the root of the cause, which I'm sure, Tammy, that's probably what you're like kind of figuring out with some of your chronic patients.
Right.
And I just was wondering if you wanted to speak to that, like if you've seen, I mean, I know it's probably too soon, but if you've seen patients that you have seen over and over again.
Yeah,
and
yeah.
how,
I think, and I think as we are in our, late 40s and early 50s, and, as time goes on, our body has a harder time adapting to what it's given. And so a lot of times something emotional can happen to us early on in our life. And our body is so incredibly brilliant. It's constantly finding homeostasis, but there's a breaking point where our body can't do it anymore. And that's really where we end up having this pain that just always is there and it doesn't go away, and we can get adjusted every day, and it's still going to pull out and it's still going to cause the pain. And people ask me all the time, why does that keep going out? What is it? And I usually will get to posture, and I'll get to strengthening muscles and stretching, but that is all physical, and there is such an emotional component to it, and that's why stress really does affect our human structure, because our body is suppressing it and carrying it with us everywhere we go. It's tightening up our muscles. It's changing our whole energy. So, yeah.
That's just so exactly my son. And I've been very open about the reason I felt I had to have Healy is because he battles anxiety and depression and was being over medicated, and it was really, but he sees a chiropractor, and
Yeah.
she wasn't able, but then she's not realizing what he's battling at home. I don't
Right.
know that he's telling her. So now he's, by sending him vibration, he is coming out of that. And he said, he can feel that now. His adjustment is holding. Now he's
Yeah.
feeling better physically. So I'm so glad you connected that.
Yeah, it is so important. And for me, I care about every single one of my patients that come in, and I just want to help them. Every time they're laying down on my table, it's like, how am I going to best help this patient? And when they keep coming back with the same pain, and I'm feeling like, okay, what am I doing that isn't helping them? I realize that it's out of my hands. It's out of my control. I can only do so much. And then what they do or what, they're bringing to the situation is really important as well. And so having this, there was another patient that when I first was introduced to the Healy that I immediately thought of, because her husband passed away 5 years ago. And she is lonely, and she has these panic attacks and severe anxiety, and she comes in all the time. And I just knew that once I got her connected with Healy, she could use this to help get through that anxiety and those panic attacks. I mean, she gets adjusted weekly, and she has for as long as I've known her. It's something she knows really affects her and helps her. So I just knew that this would be something that she can use also at home to help get through these moments. So
Right. So, were you able to run an analysis on her? Because if anyone watching doesn't understand, Healy, can run an analysis. Diane explained that on the bioenergetic field, and you can dig deeper and deeper. So, I ended up, my sister's husband passed away recently. So I was doing that with her last night, like how to best help her grief, because grief isn't a program that comes up, but
right.
what is the deep rooted things that she needs? So were you able to do that on her as well? And
yeah, so I did run it, and the gold cycle care came up for her. And so it wasn't like depression or anything like that. It was like more of a full broad aspect. And so she obviously needs to probably deal with a lot of different energy.
yeah,
So
exactly. And as we've all learned, broad is better for the first few weeks of using Healy anyway. So
Right.
yeah, like I love using the release program in the morning if I sleep wrong or whatever, because not only is it releasing my discomfort in my back from my sleeping on the wrong, but it's helping my shoulder, but it also helps mental and emotional pain too that I may be dealing with for the day. So that's always a good one to start with.
Definitely. Yeah.
Yep, I actually went back to just doing the gold cycle, like starting a week and a half ago, and it's been like it's been amazing. Like I'm just like, woo, I feel so good.
I know, it is amazing. Now, I don't know how you were able to work with your patients or whatever during the lockdown, but in the event of another one, I feel like it's such an amazing thing to be able to do some remote healing if they can't get to you.
Definitely. I hadn't even thought about that yet, but definitely I am considered essential. So I am able to stay open during the situation. And quite honestly, the majority of my patients wanted to be in my office. I've never been so busy. And it's one of those things that I think also because we are being separated socially, there's that whole other emotional component. And so that we're dealing with. And I think that a lot of my patients feel like they get that interaction in my office. I was just saying, I did a yoga class this morning, and I was talking to the lady who owns the studio, and it was explaining how I can't get rid of my patients after I'm done adjusting them. They just want to sit and chat. And I really realized is everybody is missing that human interaction. And so they feel like they get their adjustment and it releases, and then they just want to talk. So I'm becoming the therapist as well.
Oh yeah, that's like my job.
Yes, exactly.
Hairdresser of 35 years, I was more of a therapist.
Oh, yes.
When I quit, people were asking if they could still come back for their therapy sessions.
Right.
That's great.
I had a gentleman last Thursday, and the entire 15 minutes he was talking about his boss. And I just sat there and it was like, oh, and I interject a question here and there. And then we finished and we went out to the front, and my next patient was waiting for me, and he stood at the counter and just kept going on. And I was like, wow, he really needed this today. He needed to talk about it. So
yeah. You'll have to hand him a Healy and say, here's your therapy session now. Sit over here.
Exactly. Release.
Yeah. Or the job dig down and do the job programs, right?
Yeah.
That's so funny.
Right.
Well, I'm just so glad that you feel like it's such an important tool to enhance your practice. I felt the same.
Yeah, it was just one of those things. Diane, how long did it take me? An hour? And I was like, I'm interested. I'm interested. I'm in. Yeah, because it's something that I knew. Like when I had that one patient that I talked about earlier with the daughter, it was something that I absolutely knew that no amount of adjusting was going to fix her back pain. It was just not going to do it. She really needed to tap in deeper. And, her daughter had been in and out of hospitals for over a year, maybe 2 years. And so it would have been such a profound difference and faster had she had this, to use during that time. So I knew like there was another component that I needed to include in what I do. And this was just like, oh, right, perfect. This is what I needed. So
yeah.
I just have to interject on that because I'm listening to this book called The Resonance Effect. I don't know if have you heard of that? It's all about frequency and how this doctor was working on this patient, and she had this knot in her back, that she couldn't, like, she was doing all these therapies that on other people that were just releasing all the muscle tension, everything, the frequency. And she was doing the same thing on this lady and it would not go away. So she finally like went down her list of all the frequencies and she was doing it one by one. She came to emotional, she did emotional, and half of it melted away.
Yeah.
And then she did viral and the other half went away.
Oh,
and so she talked to the lady and she said, okay, when you pulled your back out, because that's where she got the original pain, she's like, what was going on in your life? Just tell me what was going on. And her boyfriend, she was sick, she had a cold.
Okay,
and
viral.
Right. And her boyfriend of 5 years had just moved out and left her.
Oh, and
I was like, oh my gosh. So it's this big knot in her back and half of it was that and half of it was the other. And after that, she was like totally cured.
Right.
Like,
That
oh
it's
my God, how we hold on to those, how we hold on to that in our tissues. And what's that saying, Sherry? The issues are in your tissues?
Yes. And I was speaking with a holistic healer and he was talking about that, holding it in your gut. Most people hold it in their gut.
Yeah.
And so, you know, you need that release.
Definitely.
Well, and I'll tell you, Tammy, this is another story that my sister has chronic migraines, so has been treating with chiropractors forever.
Yeah.
And when I ran her analysis, we just assumed, you know, migraine was going to come up, of course, right? No, lung function and bacteria came up, and eyes, which if her eyes are going because she's approaching 60, you know, that kind of thing. She has a lung disorder that is tiny pockets of bacteria all throughout her lungs. Well, she probably didn't say that to the chiropractor. So they, you know, it's not like they were, they kept working on migraine. What's all the, And so that was, so I'm able to send her, I can't wait till she has her next scan on her lungs because we've been doing a lot of that on her. So really, who knows, her oxygen level could be causing her migraines. You know, I'm not saying she doesn't need chiropractics. What I'm saying is we dug deeper and found another underlying issue. So
well, and a lot of times if it's bacteria in her lungs that's causing that, that can send out toxicity into the, you know, tissues as well, which could be causing migraines. So there's such a huge aspect with that. And as a chiropractor, if somebody came in with migraines, I would be going to go directly to their neck. What's going on in your neck? So that's huge. Yeah.
Huge.
Yeah. So that now she can go to them and say, you know, so I'm just really excited for your journey.
Me too.
Yeah.
I'm in a learning process right now and how to best help each patient as well. And also with some people, I have to tread lightly because not everybody is even, they think I'm out. I start to get out there a little bit, you know.
I'm getting a lot of that.
So I share it. I sometimes I start by saying, hey, do you know about frequency? And like, we're all frequency and we're all energy. And I kind of see where they go with that.
Exactly.
Just think back, when I think back just years ago, when I started seeing a chiropractor, my dad called it a quackopractor, you know, because Western they were so, especially in the United States, so set in Western medicine that even chiropractics was foreign to people. So now we're bringing in frequency and energy and vibration, and people are like, that's new, like I said, new age. And I'm like,
no, but it's old. It's old. It's been around.
It's way old.
So, and good, because hopefully we can do this again, and you'll have even more stories and more success and all that. So really excited.
I am too. Thank you.
Awesome. Well, thank you for your all of us getting together. This was awesome. And thanks, Tam, for joining us and telling us your experiences.
Yes, of course. I am happy to share.
Thank you so much. And if there's any questions, there will be a place in the group when I post it in the group for anyone to ask any questions that they have. I'm sure Tammy's happy to answer any.
Yeah, for
And
sure. For
thank you
sure.
enough. Can't thank you enough.
Something else that I'm just going to say real quick is that when I first heard about the Healy and thought about using the Healy, I focused mainly on the microcurrent aspect of it. I didn't focus on the vibrational. And then I started watching more videos and learning about that. And so it's that whole aspect, I think, is something that is hard for people to grasp, is that there is that the energy can be projected. And so that is something that I think for people that are new to the whole thing is explaining how maybe that works. And I'm still learning myself. So
Yeah, I agree. I agree.
Yeah.
Us informing others how it can benefit.
Right.
Yeah.
So anyway,
Well, thank you.
you're welcome.
Thank you.
All
Bye.
right. Okay. Thanks, everyone, and take care.
Bye. Bye, Diane.
Bye.